I was really excited when I heard about the Queen's Family Medicine program because every resident I talked to sounded really happy with what they had experienced. It incorporates a lot of rotations here in Kingston, but also gives us the opportunity to go to surrounding smaller towns. And that's the way that we get a really good experience because we're not competing with other residents.
You see patients about every hour to every half hour. We have an hour and a half off at lunch, which is when all of our academic stuff takes place. So we have grand rounds and journal clubs. They all take place at lunch. And then you're in the afternoon in the clinic again until about 4:30, 5 o'clock. And then usually after that, you're done for the day. If you're on call, then you have another clinic hour that evening.
Within each family medicine rotation while you're in Kingston in the first year, every month you'll do 1 or 2 half days a week in other clinics, opportunities to manage COPD, asthma, opportunities to do procedures, doing palliative care visits. So there's a hugely diverse educational opportunity within Queen's Family Medicine.
Now I'm in my second year of residency, so I'm doing my core community family rotation. So I'm working 9 to 5 usually, a regular family doctor's hours. I'm seeing my own patients, I'm dealing with all the paperwork that comes in, seeing patients in 15-minute blocks, just like real life.
Year after year we attract excellent groups of residents and they really are the backbone of the program. That's really why we exist.
So I feel that the group of residents that we get here at Queen's is really unique and really collegial. You build with each other, you build these friendships, and you're able to kind of share with each other, and that's, I think, the most important thing.
Every year there's a wilderness medicine experience which will be held in Temagami this year. And this is an opportunity for both years of residents to come together and participate in various activities in a camping style atmosphere. So it's a really great opportunity for everyone to come together.
In addition to that, there's also sort of great staff that we have that are all really friendly and really open and recognize that we're going to have struggles and we're going to have successes throughout and are there to celebrate and support us through both of those.
I think the other strength that we have is the great variety of options, the wealth of experiences that we can offer a resident when they come to Queen's. Not just here in Kingston, but in many, many different communities.
It's nice to work in a place that has a big academic hospital, but also has smaller community hospitals around and a lot of rural hospitals.
Residents are getting experience working in all kinds of different environments. Lots of experience working one-on-one with their preceptors in small settings where they don't have a lot of resources, and also then seeing what it's like to work with inner city populations of patients up north in Moose Factory with vulnerable patients, and all of that breadth of experience. Residents come out of it saying, I am comfortable putting myself in this situation of practicing anywhere because it's not unknown to me. I've seen it. I've seen family doctors doing this. I know they can do it well. And so I feel that I'm willing to put myself in that position from the get-go to try it out.
Something that's new and fairly unique to Queen's Family Medicine is the development of what's called a Nightmares course. And this course is started as soon as you start residency, and you have opportunities to work in the simulation lab, and you work with your colleagues in family medicine, and you get opportunities to experience fairly realistic, high acuity scenarios that we don't often get to encounter in family medicine. And this is helpful for when you work in hospitals and you're dealing with sicker patients, or if you plan to work in a smaller environment in a rural area and you have to deal with these situations, even as a family physician working in a hospital.
My preceptors are really supportive and young and nice. The patient population I'm working with are really supportive and really open to having residents and are really supportive of my learning. I kind of tell them, I'm a learner and I would really like to ask you more about this or your experience with that, and they're great about sitting and chatting with me.
I think that the city's size is really nice, especially in terms of being a family doctor in this area, and it's a really great patient population. So
I love Kingston. It's a great place to live. For me, I love the sort of lifestyle that a lot of people lead here. It's a really bike-happy city. I'm really into road biking, so that works well for me. I like that it's very walkable. Sort of walk score is really high. You can kind of be downtown, yet I live a kilometer out of the main city and it's really quiet. So I like that. I like that there's the student population, it kind of keeps it all young. I like that you can go out to like your favorite pub or a restaurant and you're apt to run into people that you know from your residency training, which is really nice, but it's also sort of big enough that you can be a bit anonymous.
I really love the variety with family medicine where you can really make it what you want. So it can fit to the lifestyle you want and the type of practice you want. As I've gone through my family medicine residency, more and more I'm realizing that this is where I want to be.